My name is Dr. Edward Fruitman. I'm board certified psychiatrist and I'm medical director of Trifecta Health. Today I wanted to speak about the psychological and psychiatric impact of this current coronavirus epidemic. This is being recorded on March 20th, 2020. Hopefully within a period of time this will be behind us, but this is advice for now. I'm recording this in my own office. Of course, doctors do come to work during the epidemic. At least I do, and I think most of my colleagues do, because doctors are like firemen, right? Firemen have to run into the fire in a burning building while everyone is running out. And of course, doctors have to go towards their patients when their patients are sick and everyone is running from the disease. So having said that, I know that a certain restriction on travel have been imposed, and for a good reason. And a lot of my patients are not coming to see me, but are being seen by me through telemedicine, which is something I would recommend to most of my colleagues, because it does protect the safety of our patients. So, having said that, let's come to very concrete advice that I have for some of my patients or patients that are currently suffering through this self-imposed quarantine or travel ban. First, people who suffer from depression, isolation, and travel restriction can make depression symptoms worse. In order to combat that, remember to try to reach out through either like social networks or by the phone to people you know. It's important to be in touch with other people even when you cannot leave your home. Try to use as much as possible video chat. Seeing other people's faces is very restorative and I think very important for most of us to function well. For people who are suffering from attention deficit disorder, if this is your first time working from home, try to maintain as much of a regimen to your day as you did before. So let's say if you normally work from 9 to 6, make sure that you are in a room where you're working from 9 to 6 and only come out for a lunch break, which you would, let's say if you normally have a lunch at 12, then have a lunch at 12, but then otherwise close the door and be in the room. It's very easy to procrastinate when you're working from home, and of course it's a primary symptom of adult attention deficit disorder, so try to resist doing that and don't stretch your day out from morning until you go to sleep, because then you would not feel rested and would not be more productive. But keep the same stable regimen to your life in order to be the most productive that you can. The patients who suffer psychologically the most, I think, are people who always had anxiety disorders and agoraphobia, and we can easily understand why. If a person always sees the outside world as potentially threatening to them, then of course the travel ban and the scare of the virus can make a person feel even more fearful. Try to have a realistic assessment of threat. Some of my patients suffering from agoraphobia ask me if it's okay to keep the windows open to air out their living place, and of course it is. Probably the best way to deal with anxiety in times like this is try not to overly focus on the news channels that sometimes spread undue alarm, even in alarming times. Focus on what your health department from your local government says, and focus on the recommendations by CDC, Center for Disease Control. They're easily accessible online. You can even put yourself on automatic alerts. And rather than getting alerts from news channels, which certainly my inbox is overfilled with, try to focus only on alerts that are being sent to you by state, local, and federal government. Because it's really easy to mentally talk yourself into feeling hopeless and very threatened. Also, it's very important, so unless you are under specific orders to self-quarantine and not leave your house, make sure you're taking walks on the street. It is very safe. The streets are more or less empty. Even in New York City, I can see on my Wall Street office, like I can count on the fingers of my hand how many people I see right now from my window. So it should be quite safe as long as you stay away from people within reasonable distance, of let's say 6 feet. Make sure you walk your dog. The dog needs the exercise. And walk yourself. You need the exercise as well. Stay healthy, stay safe. Don't exceed the recommendations that are being suggested by state and local government. I think our government is aware of the problem, is well advised by physicians, and you don't need to do more than what you're being requested to do. This is Dr. Fruitman. We'll see you in the next video.